Watching the number of cases very, very closely.
State health officials say they're concerned about the rapid rise neighboring states are seeing in cases of the UK variant. Both Michigan and Minnesota are reporting a surge, particularly among people in their 20s and 30s.
We know that these variants are particularly infectious, and we're seeing in other places younger people suffering from higher levels of infection.
Right now, I think that's obviously a concern that when you have more contacts and you have variants that are more transmissible, that those could perpetuate themselves, especially within those age groups.
In Wisconsin, the 20 to 40 age brackets continue to make up the largest numbers of positive COVID cases, but most of those people aren't yet eligible for the vaccine.
Is it time, do you think, to start opening up vaccine eligibility?
I do think that here in very short order, we need to have everybody really that broad eligibility.
The problem remains a lack of supply. There's not enough vaccine available yet to open it up to more people. But that could change if the variant starts to surge here, like it is outside Wisconsin's borders.
If you see a rise in the number of cases of the variant in Wisconsin among younger adults who aren't yet eligible for the vaccine, how would you respond to that?
Well, I think that's a great factor that we would take into consideration as we think about when we'd open up to the general public.
Well, Ken, if the state were to open vaccine eligibility sooner than May 1st, would it be just for that young adult population?
No, the DHS says when they make that move, that decision to open up eligibility, whether it's on May 1st or sooner, it's going to be to open it up to everyone, no more categories. But if the cases of the variant continue to rise in Wisconsin, they're going to keep an eye on that. It could force that move sooner than May 1st.